We've heard from the Health Minister and it looks like the winter COVID wave may have passed.
Indications from the Federal Health Minister Mark Butler that the winter COVID wave may have passed, but this is something they're going to be keeping a close eye on over the coming weeks, acknowledging that COVID cases tend to fluctuate around periods such as school holidays. But for now, the modelling suggests that COVID hospitalisations are coming down, currently sitting at 5,000.
The data we're seeing right now indicates that we might have reached the peak earlier than we expected to, earlier than most modelling suggested we would. Hospital numbers pleasingly are down. They're still high at about 5,000 across the country, but they're certainly down from the peak we saw a couple of weeks ago.
It was a productive National Cabinet meeting this morning. State and territory leaders dialling in virtually to discuss Australia's ongoing approach to the pandemic. Victoria's Premier Daniel Andrews speaking about antivirals.
The main contribution I made to the meeting was to, again, talk about access to antivirals, particularly for those who, on the face of it, are eligible. This is script-based medicine for the best of reasons, because it's got to be compatible with other drugs, other treatments.
Also discussed monkeypox as cases climb overseas. Currently more than 50 cases in Australia, and the federal government has flagged that as early as next week, vaccines could be announced for some immunocompromised people, and then they could start being rolled out as well. Also discussed foot and mouth disease and the impact that that could have on Australia's livestock industry. So the government will continue to ramp up biosecurity measures at our international airports.